Hello everyone! One of the most apparent signs of aging is loose skin and wrinkles. As we age, our skin loses its elasticity and tightness and become looser and saggy. And this is especially apparent in areas where the skins are delicate and thin, like the eyelids and under the eyes. Today we'll discuss techniques to reduce the sign of aging for the lower eyelids. I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. When the lower eyelids look baggy or puffy, they make you look tired all the time. This lower eyelid bagginess can cause a lot of stress that can impact your life. It can affect how you feel about yourself and make you feel insecure. Fortunately, there's a solution that can restore your comfort and confidence, reduce lower eyelid bags, improve your eyelid skin, and result in a tighter and more youthful appearance. A simple outpatient procedure called Lower Eyelid Surgery or Blepharoplasty can restore your face harmony. Blepharoplasty is one of the most commonly performed face cosmetic procedure. The eyes is an important component of face aesthetics. Lower eyelid blepharoplasty plays a vital role in the perception of aging. It helps correct loose skins, excess fat, puffy lids, and wrinkles in the eyelid area. So for lower eyelid, how do you actually do lower eyelid surgery?
In lower eyelids, as we age, we develop wrinkles in eye bags. So how will we take care of this? So for the upper eyelids, we perform incisions, take out the fat, pull, etc. But the lower eyelids, just removing tissue from the area does not result in improvements. Just removing the eye bags will not result in improvements. We must find out what is causing the eye bags. One reason could be that the fat from the deeper layers is surfacing outwards. Another could be that the skin has expanded. Third, the skin may have sagged downwards. These are the three causes. We must address all of them. So we must discuss with the patient on these issues.
In what cases would the client decide to have this surgery?
For example, this person. This person has both the upper eyelids and lower eyelids sagging. So this requires both upper and lower eyelid surgeries. If we just do lower eyelid surgery, the results would be even more noticeable coverage of the upper eyelids overhanging and the eyes would seem smaller. So we must diminish the lower eyelids. Then pull the sagging skin right here upwards while planning the area here. So we must do these three procedures here, namely upper eyelids, lower eyelids, and skin pull right here. Okay?
So, how long would the bruise and swell normally be reduced after surgery?
The very important point of this surgery, we must avoid these types of bruises. If bruises like this develop, it can lead to embolism and delay recovery. A successful surgery will have almost no bleeding after the procedure. If we look at this patient, we remove the lower eye bags, pull the tissue below it upwards for firmness, then blur this area to be smooth and remove some skin here. After all that, just 4 days later, he looks like this. No visible side effects. It has only been 4 days, but we can see that there are no bruises. Recovery is fast as such successful surgeries. Some may think inflammation is normal, but I say it is not.
사람마다 다르네요.
No, the issue is whether there is lots of bleeding or not. Some have bruises after surgery, and that is due to bleeding. In order to recover fast, there has to be no bleeding. If we look at this person, she had upper eyelid surgery and lower eyelid surgery. Both sides were lifted. It has been 20 days and we can barely see a very fine line scar. But later, even that will disappear. So the key point during surgery is whether there is bleeding or not. If there is bleeding, recovery is slow. That is the most important point.
Do we have to come back for stitch removal?
Yes. There are threads that are absorbed and there are those that are not. Some say if we use the absorbed threads, there is no need to remove the thread. But for that to happen, we need many months. But during that time, the stitch separates the tissue. So even if we use an absorbable thread, it is best to remove it. For eyelid surgeries, removal is 4 days after. In facelift surgeries, 5 to 7 days later it should be removed. In eyelid surgeries, 3 to 4 days later. Maximum 4 days later.
Okay. Are there any side effects for lower eyelid surgery?
The side effects for lower eyelid surgery, as I said before, is the turning of the lower lid. The reason they turn over is due to bleeding. Blood is absorbed and bruises form. When the bruises form, the eyelid is pulled downwards. Another is when the skin is removed excessively. And in some cases, some people have a facial structure that encourages the eyelids to turn over. If we look at this person, he has almost no bone here. Cheeks. This is most of the side effects. In order to avoid this, we must pull the skin, remove only a small portion of the skin, and avoid bleeding. These are the important points.
So for our last question, since lower eyelid surgery is removing unnecessary fats inside the lower eyelid, so would the fat regrow after the surgery?
The fat will not regrow. However, there could be fats deposited inside that may come outwards. Just like a glacier, the fat beneath will keep on coming outwards. So we distribute the fat to fill the area evenly and lift the mid-face layer. We must pull the part below the eyes upwards. Then we must stabilize, and that results in good surgery. This method prolongs the desired results, easily reaching about 10 years. So even with younger people like this one, we should not simply remove the fat here. We have to remove the fat, and also pull here upwards. And 1 year later, all the sagging skin is lifted upwards and looks like this. Whether the patient is young or old, the surgery's goal is not to simply remove the fat. We must lower the fat and lift the lower area upwards.
As we age, we develop wrinkles and eye bags. So how will we take care of this? So for upper eyelids, we perform incision, take out the fat, pull, etc. But for lower eyelids, just removing tissue from the area does not result in improvement. We must find out what is causing the eye bags. One reason could be that the fat from the deeper layer is surfacing outwards. Another could be that the skin has expanded. Third, the skin may have sagged downwards. These are the 3 causes. We must address all of them, so we must discuss with the patient on these issues. The very important point of this surgery is that we must avoid bruises. If bruises develop, it can lead to embolism and delay recovery. A successful surgery will have almost no bleeding after the procedure. If we look at this patient, we remove the lower eye bags, pull the tissue below it upwards for firmness. Then, blur this area to be smooth and remove some skin here. After all that, just 4 days later, he looks like this with no visible side effects. It has been only 4 days, but we can see there are no bruises. Recovery is fast, it's a successful surgery. Some may think inflammation is normal, but I say it is not. In terms of thread use, there are dissolving threads and those that do not. Some say if we use dissolvable threads, there are no need to remove the thread. but for that to happen, we need many months. But during that time, the stitches separates the tissue, so even if we use a dissolving thread, it is best to remove it 3 to 4 days later. Thank you for joining us once again at CloudHospital TV. If you have any questions or comments, please leave it down below. We will respond to you as soon as we can.